Do you have any advice for us as we go into our residency period?
Why, yes, I do. In case you decide to do some, as you work on your projects, in case you get assigned something like the tree lighting ceremony at your facility or CFC campaign manager, don't try to turn those into projects. Definitely you should be shooting for at least 5 projects. You may not get 5, but you should be shooting for 5. If you turn in 3, you are taking a lot of risk, so don't do that. I've said that in prior years, and for some reason some people don't listen to me and they inevitably get their stuff turned back. So if you want to avoid having to do a rework on your projects, try to shoot for 5 projects, make them real. And that said, you should have fun in your residency as much as possible. Try to learn as much as possible. Go to every major meeting that you can go to, even if they seem boring. You might be surprised by the lessons that you learn just by being a fly on the wall. And try to be a fly on the wall wherever you can at the highest levels possible. And work hard and make a good name for yourself.
Well, make sure your residency is fully rounded. Just don't stay in one department. Go around to all the clinical services, go to outpatient services, understand the entire function of the entire hospital, not just one aspect of it. So get a total view.
First off, have fun with it, enjoy it, soak up as much as you can. It's a free year, so take advantage of that. Second thing I would be, or I'd encourage you to do is, reach out to as many of your peers as you can. You have members of your class at the highest level performing organizations in the country, if not the world. So take advantage of that. Beyond that, from the residency standpoint, hopefully by this point you understand the residency is a learning experience. But as we start talking about the deliverables that are due back to the program, don't do the bare minimum. It'll end up catching in the end. I'd highly encourage you to do 4 to 5 portfolio projects. Make sure that they're showcasing your abilities and what you've contributed, and then from that point, really try to get into the meat and substance of what the organization really needs. It's going to do you some benefit, and it's also going to do the organization some benefit as well. Beyond that, the residency is meant to showcase your abilities. So make sure that those shine through.
Enjoy it, because it may be the only time you get to just float around to the different areas and learn something and not have to have something, a product due that people rely on you for. So enjoy it and get the most out of each rotation.
So I would say the biggest thing is that the residency is what you make of it. And so I would say take the opportunity to learn as much as you can. As I told several residents, when are you ever going to get a chance to have an entire year to learn and to focus on those competencies that can be strengthened, that you can improve on? So that would be the #1 thing. Make it your own.
Go into your residencies with a long-term plan. Don't wait till the last minute to prepare your projects. A long-term plan that's set in motion early on will allow you to learn more and be more methodical in the preparation of your final project. Last-minute projects are very obvious.
Well, I'm sure you're going to hear this from other faculty members, but we just reviewed residency projects, and I encourage each of you to work on those ahead of time. But I also recommend, you're probably thinking that June 13, you're done with all of these classes that you've been cramming into your mind this last year, and truly you've accomplished a lot and just making it through this year. But you're not done. You need to look at some key courses, and review that material, statistics, operations management, and so on, and that will provide the context for the appropriate development of good projects, and it will make the execution of those projects a pleasure instead of a pain. And we want everyone to pass the projects first go around, and that's my goal for each of you.
During the residency, I'd say just get out there and spend some time shadowing people. Don't just simply do project work. I'd strongly recommend administrators should go and spend some time with the nurses, see what the physicians do. Just not only spend a couple hours, but maybe take a week and spend time on the units. And then same thing with the clinical staff. Learn what the administrative staff do, and spend some time actually viewing what they do, so you can put some of the knowledge from the classes to practical use, and you can observe it that way.
During residency, maintain your resiliency, keep your eye on the target, do good, learn lots, don't take it too seriously. Make sure you understand the research question, formulate a strategy, get adequate data, use the appropriate statistic, be brief, and be seated.
Build teamwork in your residencies, and be open to new ideas. You can never, don't listen to the people that say that's the way we've always done it.
I wish you all the very best as you go forth in your residency. It is a great time, great learning opportunity. Take advantage of all the things that you have to do, all the opportunities you have during your residency, but make sure that you also have an active learning program beyond the residency. Unfortunately, most of the knowledge that you've learned in your graduate program will be obsolete in the next 3 to 5 years. So if you're not actively learning, with a reading program, doesn't mean you have to go get an extra degree, but it does mean you need to have an active reading program, an active learning program, so you can remain current in your jobs. I wish you all the best. It's an exciting time to be in healthcare, and I know you all will do very well. Best of luck to you.
If you don't figure out what you want to do and learn during your residency, somebody is going to tell you, and it may not be the right things. So I would say, take control of your residency, figure out what you want to do, ask for it, you'll probably get it. Consider some time at your home MTF, or the MTF that was your home MTF when you were a child. Very often you can get time off to go back there, not TDY, but time off. Perhaps you could stay with family. It gives you an interesting perspective.
I have a couple of pieces of advice. First thing is, of course, start early and get your projects moving. Even if you jump into a project that's already ongoing and you can participate substantially, if you can add to it so that you have something that you can put in your portfolio, I'd say get on it and do it early. The second piece that's in conjunction with that is use your advisor. Send them emails saying, look, how about this idea? What about this if I use this and that level, this method of analysis for this problem and this project? So do your projects early, do them, contact your advisor early and often on your projects. Realize that your advisor is here and it's a little bit of out of sight and out of mind, so make sure that you're being proactive and getting back and getting feedback on your projects early. The second part of it is, you're done with your orals board. The education, I hope you realize, will continue through the rest of your life. So take this opportunity at the resident sites to focus on some of your areas of weakness. You know, to hit, if you're having trouble with the finance, get with their RM folks and have them teach you some things. Make them work, or at least make, if worst case, make them send you away after you've annoyed them too much.
As you move into residency, make sure that you are integrating, because if you do not integrate, I am going to come back and haunt every one of you all.
You probably don't remember it, but I had 3 key points about my philosophy of life that I shared way back last summer. And the first one is that we're a world at war, and that there's good and bad, and that I encourage you to be positive in everything that you do. Secondly, things are not always as they seem. And you're going to find that is quite true during your residency. So how are you going to go about rooting out new learning opportunities in your residency? Well, what I suggest is that even a blind resident can find learning opportunities if he roots around long enough. And then finally, each of us play a crucial role. in shaping the future of healthcare. And what a great time to be involved in change. So that's where leadership comes in. So I encourage you to put your LPI into practice, talk to your preceptor about that, and really take that next step in going from being a good leader to a great leader.
You should aspire to learn a lot, to be good, and have fun. And so that part about learning a lot, just plug yourself in. This is a wonderful opportunity for 1 year. Just ask questions. Anything that you had a zeal for learning and knowing, and you've always wondered what was behind the curtain of this Oz of a world that we live in. Look, spend some time behind that curtain. Get to know the wizard and all the different places that they operate, so that when you are in positions of authority or responsibility, you're not making decisions or judgments based on unknowing or an absence of experience. You have a chance to plug in and have a really thorough understanding of the way that healthcare is organized and delivered. And so take every one of those opportunities. The be good, you're great already. And I think just continue to do those things, provide value, develop the portfolio projects. If you have a chance to publish an article or do a newsletter or spend some time sharing the knowledge, please do. And then have fun. It's 1 year where you're still a student, but you get a chance to see a part of executive healthcare at a relatively early stage in your career in preparation for all the things that we expect you to do downstream. And love your family, your friends, enjoy life. Don't drag around a ball and chain of responsibilities that seems like it's always dragging you away from the folks that you love and want to spend time with. Break that chain, make your life, professional and personal, one and the same, and I think that you'll see that you can do many great things and really enjoy this life.